Elena and I would like to present a new femoral shaft fracture pathway in children.
The main points of this pathway are that this injury is always an emergency and that you should always call a doctor straight away. Assess the limb for ischemia, and if you have any signs, you must transfer your patient to a different hospital urgently.
Analgesia is best provided by a femoral nerve block, so it's important to apply local anaesthetic gel to the groin area as soon as possible. The femoral nerve block should be given by an experienced doctor under ultrasound guidance. Occasionally, ketamine might be required for sedation, but this is not usually the case. Most of these children will arrive in a splint, which is good for analgesia and hemorrhage control. If one is not already applied, there's an introductory demonstration on eResus, which is a video that Elena has made. If the child is still in pain, please consider giving intranasal fentanyl if the child is over 1 year old.
Call the trauma and orthopedic nurses, as the definitive treatment for this type of injury is a skin traction. These type of specialist nurses will apply this on the ward or wherever possible in A&E if a bed is not available at that point. Add padding where the pole meets the limb and other pressure points like ankle, thigh or groin. You can use gauze, Gamgee or K-Soft or a combination of these. Always try to admit your patient under 90 minutes where possible.
So before the patient transfers to a ward, just don't forget to check that there's enough padding of the skin. And remember that in under 4-year-olds, the commonest cause of this injury is non-accidental injury, and that will be up to 30% of those. If that's the case, a safeguarding referral will be required. If you have any further questions, please ask Elena or myself.